Good afternoon, everyone. My name is Cheryl Strange, and I am the Secretary of the Washington State Department of Corrections, and I have some wonderful colleagues with me here today. We're here to talk about Reentry 2030, which is a national initiative around justice reinvestment. So in Washington State, our incarcerated individuals in our care and custody rely on all of us to come together in order to make for a successful reentry from prison life back to the community. And without further ado, I'm going to ask each of my colleagues here to introduce themselves, and then we'll get started. Thank you for being here.
Good afternoon. I'm Danielle Armbruster, Assistant Secretary for the Reentry Division, Washington State Department of Corrections.
Good afternoon, Ted Kelleher, Washington State Department of Commerce. I'm the Policy Director in the Housing Division.
Lou McDermott, I'm the Deputy Director for the Healthcare Authority here for Sue Birch.
Good afternoon. I'm Jilma Meneses, the Secretary of Washington State Department of Social and Health Services.
Good afternoon. Alberto Isiordia, Assistant Director of Operations for Employment Security Department, here to talk about WorkSource's role in serving reentry populations. Thank you.
So I'm going to talk a little bit about what is Reentry 2030 and why does it matter. Washington State will be the third state to sign on to this national initiative that's in line with President Biden's reinvestment initiative for justice-involved individuals and is focused on designing and implementing a humane reentry system across all human service state agencies that are person-centered, coordinated, transparent, and equitable, and make reintegration a reality for all by 2030. It is focused on being human-centered and really thinking about how we incorporate the best practices for our individuals that are under our custody and care. It's thinking about how our efforts can be coordinated so that we ensure that all service systems at federal, state, and local levels are all integrated together. It's also about transparency and focusing on our public goals, metrics, and reports so that we regularly have consistent progress on the transformation of transitioning individuals into the community. And lastly, it's about equitable. It's about data-informed decisions to drive our investments for the people in the communities that have the most needs. I'm going to talk a little bit about what is the purpose of the Reentry Council. Janelle McPhee is the Executive Director of the Governor's Reentry Council, which is a boards and commissions. I sit on that council on behalf of Secretary Strange and honored to do so. Really, the Reentry Council is focused on advocacy and really thinking about the investments and the attitudes to improve the reentry systems. I'm going to talk a little bit about how the Reentry Council focuses on their support of the initiative of Reentry 2030. Really focusing on their strategic planning, we've taken a lot of time to focus on what is important to help the individuals that are under our custody and care. Specifically, I'm going to talk about goal number 2, to embark on the process of becoming a Reentry 2030 state. The council is supportive. They've signed on to the initiative. The goal is to have our Reentry 2030 launched by the end of the year. We will have an updated executive order from Governor Jay Inslee that will not only focus on what the council is doing, what the Department of Corrections is doing, but what all of our other fellow state agencies and community partners are doing. Thank you.
Thank you, Danielle. From the Department of Corrections perspective, and yeah, if we could get the next slide, thank you so much. Just a quick snapshot of what reentry looks like at the Department of Corrections. Obviously, the focus is while people are in our care and custody, there are things that we do to help create the opportunity for incarcerated individuals to lead successful lives in the community. And you're going to hear from each of my colleagues about the role that they play in this work. And I thought it would be good to start with, what do we do at the DOC in terms of getting people ready to leave our care and custody? the Reentry Division is one of the divisions within the Department of Corrections, and it focuses on programs, education, treatment, work readiness. And the division itself has about 800 staff in it, and it has a biennial budget. That's a 2-year budget of $154 million. And what is so is that when an individual comes into prison, there is a comprehensive assessment around needs, around risks, around education needs, housing needs upon release, healthcare needs, parenting needs, a variety of concerns and opportunities to develop an individual reentry plan. And that plan stays with the individual from the day they arrive here at the DOC till the day they release. And so in a nutshell, comprehensive assessment. While an individual is incarcerated, we focus on these areas. I'm really excited that in this last budget session, we got funds to hire 108 navigators to actually help coordinate connections upon release to my colleagues and their agencies here. So with that, I'm going to turn it over to you, Ted.
Great, thank you. Again, Ted Kelleher, Washington State Department of Commerce. The department deals with housing in general, affordable housing with some specialized programs, funding counties to work on reducing homelessness, unsheltered homelessness in general. We do fund navigators throughout the state that help people find housing opportunities. Some of those navigators are currently focused on people exiting prison and jail, but just more generally, there's navigators available to help people get into housing across the board. One of the problems we have in Washington is we're a very fast growing state, lots of people moving here, a very dynamic job market that attracts a lot of people. So we, as a result, and we haven't kept pace building housing as people have moved in. So we have very, very low vacancy rates. It's difficult for anyone to find a place to live, even with a perfect history and income. And people exiting prison and jail have an even harder time. When landlords can be selective in a very low rent environment, they're likely to choose people that don't have as many barriers. So navigation is key, and we'll continue to fund that. But I think is at least as important is making sure that there's enough units generally, and then there's enough specialized units for people such as people exiting jail and prison. Along those lines, the governor asked for $4 billion investment over the next 6 years in housing. The legislature and some legislative champions following the governor's lead did invest $400 million for the Housing Trust Fund, which will build more units generally that are subsidized for people with lower incomes, and also will just expand the supply of housing. Programs that are focused on reentry are eligible to apply for that resource. One of the programs that we're proud of, that's showing our increasing partnership with other state agencies, is Apple Health and Homes in cooperation with the Healthcare Authority. So many people, many people just need a subsidized place, or they just need help getting to a market rate place because they're able to find a job and work. Some people have complex behavioral health needs and a long-term disability. And with Apple Health and Homes, we're bringing in partnership with the Healthcare Authority to bring in the Medicaid money to pay for the services, because that services are critical for many people to stay stably housed. And then Commerce is funding the housing. And it's that kind of partnership that we want to continue to build out, and that we can look at this reentry initiative, expanding those sorts of cross-agency where there's a really tangible, coordinated response to people with needs. And then finally, it's one of the roles the department plays through the housing division, but also through the growth management section of our agency, is local land use is really critical. So there's a situation where we oftentimes will release a grant and there just isn't a place to even build the buildings. Our land use hasn't kept up, our zoning hasn't kept up, not only in terms of volume of places in general, but the variety of types of places we need. Some lower cost, smaller multifamily in every community in the state. There was some significant progress in the last legislative session, working to push local governments to rise up to the challenge of the growth we need to accommodate. In particular, as directed by the legislature, Commerce released targets for every community, every county and city in the state, targets for not only the number of units they're going to need to build over the next 20 years, which is 1.1 million, but it breaks it down by income strata. So for instance, you'll need X number of the new units for lower income people and X for middle and X for higher. And so in every community in the state, I'd really encourage everyone to engage in their own local community who's going through that process now. They have that number and they need to sit down and figure out, where are we going to site all these different types of housing, apartments that are market rate apartments, single family homes, specialized places like permanent supportive housing for people with behavioral health. Again, these facilities need to go somewhere. It's been somewhat logical for individual local governments to say, we don't want any of that. But if every local government does that, we end up in the situation we're in today. So we all need to work together, figure out how to divvy it all up, and get that expansion of supply, which is going to not only help all of us with lower housing costs, but in that game of musical chairs where people who are, don't have the more normal background coming out of prison, for instance, it's going to make it easier for them to find a place to live too. And with that, I'll hand it over to my partner from the Department of Health.
Department of Health. Oh, Healthcare Authority, close enough. So my name is Lou McDermott. I'm with the Healthcare Authority, and this slide, MTP 2.0 Reentry Program Summary. Basically, what we're doing is we administer the Medicaid program at the Healthcare Authority. We've got about 2 million people on Medicaid in the state of Washington, and we have a contract with the federal government that tells us how to administer the program. And basically, you're not supposed to provide services for people who are currently incarcerated. So we had to go for what's called a waiver, which means, yeah, we see that rule, we just don't want to do that. And the federal government agreed and said, okay, you've got some good reasons why you want to do that. Let's go ahead and do that. A few other states have done it. So what we're going to do is we're going to try and put people on Medicaid 90 days before they get released. And by doing that, we can get them on, we can get their Medicaid, their medications transferred onto the new insurance, because basically when you're incarcerated, DOC is providing all of your health care. And now you're going out into the world and you'll have Apple Health. We'll be able to find you a clinic to go to, a doctor. If you need behavioral health, if you need substance abuse medications or treatment, we'll be able to provide that for you. And trying to basically, I think a common theme up here is removing barriers and trying to make sure people are successful. One of them is healthcare. So making sure that before they leave, they know who their doctor is, they know what health plan they're in. They have 30 days worth of medications, and they're able to go out in the community, and especially for those individuals that have higher health needs, be able to get those addressed right away and not get out, try and get on insurance, then try and find a doctor and do all that. And in the meantime, bad things might happen. So I think it's about removing barriers. It's about getting people on insurance early before they get out, making sure they have all their medications, making sure their medical history has been transferred to a new physician so they understand what they're dealing with. And in a nutshell, that is MTP 2.0 as it applies to incarcerated individuals.
Thank you, Lou. Jilma Meneses again from DSHS. Incarcerated individuals who come out of prison or jail have a second chance most of the time, a second chance for a good life, for a happier life. And so for us, it's imperative that we give them the tools, the services that they need to be successful. And that's what you're hearing this morning, this afternoon from our colleagues, our sister agencies. Our goal is to give folks the tools that they need to be successful in their journey in the second time around. And sometimes it's third or fourth time around, but hopefully not too much more than that. Our goal is to invest in these services, because investing in these services is not only investing in the individual, but it's investing in community and society. The safer they are, the safer we are. And the more help our colleagues get as they leave, the better the community is in the long run. And so with DSHS, we provide services, basic food help, otherwise known as SNAP, TANF, Temporary Assistance for Needy Families, and Aged, Blind, or Disabled Cash for those who are aging. We also, with our partners at Healthcare Authority, we manage the Apple Health for Kids, the Apple Health for Adults, and in particular, the Aged, Blind, and Disabled Medical Program, and also Pregnancy Medical Program for those women who are leaving the system and who are pregnant. We also have a program for child support abatement. An eligible incarcerated parent may have their child support temporarily reduced to $10 per month for a period of time. So we help them through that. And very importantly, we try to do this prior to release from the public institution. So the navigators that my colleague, Secretary Strange, talked about work very closely with all of us at the respective agencies to do just that, to set them up with the services that they need. We actually even have an individual, his name is Max Gibbs Ruby, who's a half-time employee for DOC and half-time employee for DSHS, who works closely with those navigators to make sure that those barriers that they might encounter for the incarcerated folks are relieved. That's a really important position for us, and because it's hard for anybody to apply for benefits given the complexity of the programs. So if it's difficult for the normal person that is outside already, think about how hard it would be for that person who is incarcerated. Those navigators are critical, and then the help the navigators receive is also critical. The Aging and Long-Term Care Administration, also under DSHS, is also key, because there are folks who are incarcerated who are leaving the system as an older person, and they need long-term care. They can't go into the normal housing that was discussed by our colleagues in the Department of Commerce. So they have to go into a long-term care facility. That's what ALTA does, is they try to help these folks be placed in the right location. And we also have the Division of Oak Rehab that works with individuals leaving the system who are disabled and to find employment. So we're very, very pleased to work with our sister agencies. We can't do it alone. As others have said, it has to be a collective, and it has to be collective for the benefit of society as well as for the individual. So now to my colleague.
Thank you, Helma. Alberto Isiordia with Employment Security Department, and I'm delighted to talk about just another important resource that we bring to the table here. I know Secretary Strange talked about the social determinants of health, and one of the key supports that are important to provide to our reentry population is employment, and ideally more immediate employment. And so that's where our WorkSource partnership plays a critical role. Employment Security Department is part of that WorkSource partnership, a partnership that is made up of state agencies and community-based organizations, all with the goal of providing employment and training resources for individuals so that ideally they find employment and the right employment that they are seeking. And so when we talk about our reentry population, serving our reentry population is critical to the equity work that we do at Employment Security Department. We recognize that many individuals that are incarcerated are individuals that come from poverty and that are largely come from underrepresented and marginalized communities. And so recognizing that is where we're looking to continue to amplify our support in partnership with not only our WorkSource network, but also the Washington State Department of Corrections. And so some of the things that you'll see here in this slide is you'll see a breakout of our facilities, both on WorkSource and the Department of Corrections, and the various programs that both organizations offer. On the right, you'll see Department of Corrections and a breakdown of their educational programs by location. And on the bottom of the slide, you'll see a breakdown of several of the employment and training programs that we offer through our WorkSource services. One key area of focus that we have as we move forward in our partnership is to continue to intensify support while individuals are incarcerated. We recognize that by engaging individuals while they're incarcerated, we're more likely to be successful in not only providing them that job coaching that they need, but ideally post-release that they find immediate employment. That's really our goal. And we recognize that if we wait till they're released, we're at a disadvantage, as what we find is many of our WorkSource customers that come in and engage with us don't often want to tell us that they've been in prison or have been justice involved. And so for us, the ideal is to engage them when they're incarcerated. So we certainly have some efforts where that is occurring already. A good example is our state veteran state grant, where we do have some facilities where we currently enter and provide case management support to our veterans with the goal of immediate employment post-exit. We want to continue to expand on that model and to do more of that, and to not only do that in person, but one key thing I failed to highlight in my last presentation is our agency is really focused on expanding our virtual services footprint. And we know that Department of Corrections continues to work in the digital space, and we're hopeful that as that occurs, that we can partner so that we can engage not only in person, but also virtually. And so thank you for your time today, and certainly would welcome entertaining some questions.
I know we're going to have some time for questions here if there are any. And okay, it sounds like we don't have any questions at the moment. What our last slide here is really our contact information for learning more about Reentry 2030. Every individual that comes into the Department of Corrections is on a path out of the Department of Corrections. And it is very important that we work collaboratively as we do. You're seeing these key agencies showing up and suiting up for this hard work and changing policy, changing access so that we can improve the community experience for incarcerated individuals. You'll see a reference here to the National Reentry 2030. We're not waiting till 2030 to do this. We've been doing this for a very long time. And these partners that you see sitting here with the DOC at the table recognize that reentry is not just a Department of Corrections problem. These agencies are stepping up and showing up to help incarcerated individuals release from prison and be successful. You heard healthcare, you heard housing, you heard poverty reduction services, and the plethora of services that DSHS offers to really 2-some million Washingtonians. It is a big chunk of our population. We are trying to make a better Washington for all Washington residents. And we have a ways to go with that. So we appreciate your support. And again, if you have any questions, we're here to answer them. There's our contact information. And it sounds like we do have one question, and I'm about to hear what it is.
This question is in reference to our CW 3521-830, controls on rent for residential structures. And basically, the question is, one of the barriers to making and keeping housing affordable, or that RCW may be one of the barriers. What efforts are being made to overturn or go around the code?
I think that we ought to turn that over to our commerce person. There are a heck of a lot of RCWs, Ted. Here we go.
Yes, no, I believe that's the rent stabilization RCW being referenced. And just to get on the weeds a little bit, currently there's a state law that forbids local governments from implementing rent stabilization. And there's also no rent stabilization at the state level. Many communities, states on the West Coast and around the nation have rent stabilization. Those words encompass a lot of different policies. And I think there's really an active debate about how, if Washington were to go down that path, how to calibrate it. At one extreme, it's so tight that you don't get the housing production you need because you've put so many regulatory restrictions on rent that builders take their money elsewhere. And on the other extreme, it's so loose that it's performative. It's not actually stabilizing rents and making a meaningful difference in helping people. I know the agencies are actively engaged in that discussion, what it would look like if that's a direction we need to go. I think one of the critical things, rent stabilization can play a role in preventing sudden changes in rent, which can be very destabilizing for people. As enacted along the West Coast and in many other states, in the long term, they don't make a difference in the absolute level. So it's really critical to know that it can be important and increase stability. But in the long term, you're still going to get people priced out if you don't get costs generally under control through appropriate land use, and also, at least as critical, investments for people at the lower incomes who are not able to afford market rate housing.
Thank you, Ted. Are there any more questions? No. Very good. Well, again, thank you all for coming, and we appreciate your interest, and we appreciate you out there as in your home communities working hard to encourage a livable wage, a place to live, access to health care, and a safe return to the community. So thank you for all that you do to help us do what we do.